歡迎大家。
Welcome to the press briefing. On stage, we have Dr. Zhang Chukwan, Head of Communicable Disease Branch Center for Health Protection, and Dr. Sarah Ho, Chief Manager from HA. I'll give the floor to Dr. Zhang first. Good afternoon. Last night, we had 37 positive cases, 31 of which were imported, 7. Well, we have 1 local unlinked case and 6 import-related cases. For the unlinked case, is number 12872. I talked about that yesterday. She is shop assistant at a supermarket. She has been to different supermarkets to scan products. She lives with her husband, with her family at Lishan Building, Wan Chai. Her last date of work was the 6th of January. And for colleagues who were in contact with her, have been sent to a quarantine center together with her family members and also relatives who had eaten with her. She was not vaccinated, and then starting from the 6th of January, she developed a headache. And she did a rapid test at home and was tested positive on the 6th of January. She sought help at Rattanji Hospital, and she was confirmed positive, and her CT value was rather low, 17.7. Her sample was found to have N501Y and also T478K. It looks likely to be an Omicron variant. She is now doing a full genetic test to see whether she is linked to any previous case. As regards her activities, on the 3rd of January at around 12:30 to 1:30, she went to the Hong Kong Brands and Products Expo. We don't have any preliminary positive or confirmed case present at the same time. On the 3rd of January, she went to St. Paul's Hospital for an X-ray and to see a doctor. She has been to Wan Chai Market many times on the 27th, the 30th, 1st of December, the 4th of January. On the 29th, she went to the Lockart Road Market. She has been to some eateries, including Fairwood at Wuchong Building, Shanglok at Wan Chai Road, that is Joyous Restaurant, and also Yu Yi Bing Sat Private Kitchen, and also Dine In Tinok Lane, and Tomato Si Heng Gong Wing Cafe, and also Yat Fung Mei Sui Ki Sik Tong. In her activities, we have not found any places of overlapping with confirmed cases or overlapping time. Of course, she's been to Wan Chai, Causeway Bay, and Happy Valley. She worked at those supermarkets, and we are now studying whether there was any overlapping in time and location. Those places have been visited now. For those who have been to these places, members of the public, you have to be tested. We're now doing an epidemiological study and would like to wait for the full genetic analysis to see whether it can help us to understand whether the case is linked to any known cases. We've got 6 import-related cases. 12874. He went to Moon Palace. Together with 12611 and 12637, they had meal together. She was confirmed positive at quarantine center. On the 29th of December, she was sent to the quarantine center. The tests done on the 28th and the 29th were negative. And then on the 6th of January, she was tested positive. Starting from the 1st of January, she had mild sore throat. On the 27th, together with 2 friends, they went to Apple Store and then had meal together. Another case was a 4-year-old child. a member of 12767 living in Training Garden, Block 2. She was sent to the quarantine center on the 4th of January. She studied in Shantak Fraternal Association, Leung Nei Chau Yu Kindergarten. So on the 5th of January, she was tested. The result was not confirmed. She got admitted and is now a positive case. Some close contacts at school have to be sent to a quarantine center. And then we've got 12880. A colleague of 12825 working for CITIC Securities. As I said yesterday, together with 12825, she went to Causeway Bay and went to Palace Cuisine, and he was sent to the quarantine center. He went to Outbreak Market and also at Choi Fuk Hei Yin at Fortress Hill. Another confirmed case, 12882 on the 2nd of January. She met 18388 at the Product and Brands Expo. They checked her for about half an hour. She for a time removed her mask and drank water. She lives at One Poon House, Changwon Estate. She works on the 8th floor of Y Square in Chaiwan. She had received 2 jabs of vaccination. During the infection period, she went to Hysan Plaza, Nabi, and she also went to the Brands and Products Expo, and then McDonald's at Hong Ham Station. And 12883 is another Indonesian domestic helper working at a place in Yuxing Building, Happy Valley, on the 1st and the 2nd of January. She went to a church on the 14th floor at Watson Road. And on the 6th of January, she developed cough and a runny nose. She was tested positive at testing center. She had received 2 jabs of Comirnaty. On the 6th of January, she went to Mingwo restaurant at Wan Chai to eat. And then another case, the 4th Indonesian foreign domestic helper case. She was identified at a quarantine center, age 44, living in Oning Garden of Changwon-il with family members. She had received 2 doses of vaccines, and she was sent to the quarantine center on the 6th. And then she developed a cough and fever on the 7th. She was sent to the A&E department of Changwon Hospital, and it's now a confirmed case. Together with the case I mentioned, they went to the church and they met there. In the same church, there were about 100 persons sent to the quarantine center. Because we have new cases, we are checking whether there are more close contacts that need to be sent to a quarantine center. We have got 30-odd preliminary positive cases. 5 are worth mentioning.
The first preliminary positive case the first and second cases are Indonesian foreign domestic helpers. 12854 lives in Tai Po, Mason Mansion. That's the employer and the children. 13-year-old. The child is 13-year-old and goes to school in Mokyan School in Tai Po. On the 7th of January, was sent to the quarantine center. As for the foreign domestic helper, returned home on the 2nd of January after spending 2 days at the church. As for the child of the employee of the FDH, stayed home on the 3rd of January and then went to school on the 4th of January and had lunch with a classmate. The classmate will also have to be quarantined. The child has also gone to tutorial classes. So the tutors will also have to be quarantined. On the 5th of January, the child got tested. The result came back negative on the 5th. The child stayed home on the 6th and was sent to quarantine center on the 7th because the child had a fever. So the child got tested at the hospital and later turned positive. The family members, that is the employer, was also sent to the quarantine center on the 7th of January, developed a fever, and were sent to a hospital where they later tested positive. On the 3rd of January, the employer went to a restaurant called 幸福餐廳. During lunch hours, around 11 a.m. to noon, and then around 7 p.m., they went to another restaurant called Tonga. And they went to a Hinström concert, area 46th, row 20. On the 5th of January, this person also went to the restaurant called 幸福餐廳. The place of work is a place called 家風台. It's a clerical worker at a real estate place. Another person, another preliminary positive case. It's a 3-year-old child. It's the family member of someone who dined at Six Garden Restaurant. It's the grandson of 12821. Lives on 18th Jupiter Street at a place called 盡景台. On the 31st of December, at around 9 a.m., this child was at Six Garden Restaurant to meet up with family members where he had a sandwich at the restaurant. His family member also tested COVID positive. There was a lot of contact between this child and the family members. So it's hard to tell whether the infection happened at the restaurant or later on at home. His last day at school was the 3rd of January. He goes to a restaurant called 香港領養堂幼稚園. His classmates are considered close contacts and will be sent to quarantine. There were also 2 to 3 children with upper respiratory tract infection symptoms. So we will arrange tests for these school kids as soon as possible to determine whether infection happened or it's just something else. Apart from going to school, the child mostly stayed home and stayed with family members. And also went to get tested. On the 3rd of January, the child went to Layton Center to get tested. He was there again on the 4th of January to get tested. And on the same day, that is the 4th of January, the child was sent to a quarantine center. Starting from the 7th of January, the child developed a fever and was taken to a hospital for a test which came back positive. Another case, a 71-year-old female. That's another preliminary positive case. We had 2 cases who were colleagues of 12825 of the person who worked at CITIC Securities. The office is at 252 Kings Road in North Point at Olympia Plaza. On the 3rd of January, this person went there to visit a friend at noontime. We believe this person got infected around that time. And then after the visit, she visited a place called 美肌中心 for a massage. And then on 5th of January and 6th of January, she went to a place called Gagohin. It's like a restaurant in North Point. She also went to the Baldwin Market to do shopping. And nothing out of the ordinary in terms of her other activities. The last preliminary positive case I want to mention here is someone who works at the airport. It's a cleaner who cleans the aircraft. It's a 39-year-old female. She works from 7:30 a.m. to around 1 to 1:30 p.m. She lives in Yattong Second Estate Shunyak House, where she stays with her family. She cleans the interior planes, the toilets, for example. She also replaces pillowcases and takes out the garbage. She works on the duties with her team. She's in high-risk group, so she gets regular tests. On the 2nd and 4th of January, her tests came back negative. She mostly goes to work every day and visits the Yattong Estate Market. She takes the S56 bus to work. On the 7th of January, she started developing a fever. So she went to the North Lantau Hospital A&E department, where she left a saliva sample. She was worried that her employer may request her to take a throat nasal swab to meet the requirements. So she returned to the airport, where she left another specimen. Both specimens, whether at the airport or at the hospital, came back positive. Her CT value was low. The specimen at the hospital, the CT value was 16.9. After being admitted to the hospital, her CT value came back 19.3, which is on the low side. We suspect that she may have been infected while cleaning the cabin. Given all the imported cases we had recently, she might have been infected at her place of work. So that's all from me for today.
Dr. Sarah Ho, the situation with HA. Good morning. As at 9 this morning, in the past 24 hours, the HA system has reported 53 cases. We have 8 patients in the past 24 hours recovered and discharged. So far, 12,243 patients have recovered and been discharged. We still have 373 patients receiving treatment at Northampton, Hong Kong Infection Control Center and HA's Infectious Disease Control Center, and also the Asia World Expo treatment facilities. All of them are in stable condition. Number of negative pressure beds, 1,085. Utilization rate, 65%. Negative pressure wards, 606. Utilization rate, 67%. Thank you. Now it's question time, so please identify yourself and your organization before you ask questions. The gentleman in gray. I'm from Now TV. Good afternoon. With regard to 58-year-old female unlinked case, can you tell us more about the supermarkets she worked for? And the one that have been to Hin's Zheng's concert, what was the date? And what is your assessment? Who among the audience would be considered close contacts? In Hong Kong, we have unlinked cases. Dr. Zheng, do you think that there should be class suspension, or should the government arrange a work from home arrangement? Hin's Zheng's concert. Usually, members of the audience wore masks, and all who've been to the concert have to be tested. We don't believe there are close contacts in the audience. School cases. I think the relevant authorities would keep in view all relevant matters. So a class suspension is not solely public health consideration. There are other factors at play. Supermarkets, the exact locations. Well, she went to different places on a daily basis. On the 6th of January, well, she only stayed for even 1 minute or 5 minutes or 10 minutes at each location to scan the shelves. Well, she went to Manning's, Super Yoko, and also Park and Shop, so and so forth. And then Hazen Row and Manning's at Times Square. On the 5th of January, Manning's at Homentin and Watson's at Oyman Estate, and also Manning's. Manning's and Marketplace at Homentin Square. And then Manning's at New Mandarin Center. And then you select at Checkham and Marketplace K11. Museum Marketplace, Manning's, and in Wan Chai Wuchong House, Manning's. On the 4th of January, on Wan Chai Market, Watson's at Tsim Sha Tsui, and also the China Ferry Terminal, Watson's and Manning's at Kwong Tung Road, Watson's on Hong Kong Road, one on LG, one on G floor, and then Park and Shop on Peking Road, and also CLC and Marketplace and International in Tsim Sha Tsui. And the 2nd of January, Park and Shop Hopewell Center, and then on the 1st of January, Park and Shop at Chak Zap Sing Center. Cable TV, well, the unlinked case has been to so many different places. What is your assessment of the risk of infections she has created in the community? And for the sewage samples of Meilan House, there are positive cases. Do you think that there are silent cases living there? And the CT value of the mother of flight attendant had quite high CT value, and she has spread the case to many patients. Would you regard her as a super spreader? Of course, there are risks in the community because she's been to different places while her duration of stay at each location was short, and she was wearing mask. But then her city value was low, and she's been to different places in the territory. So we are worried because, first of all, her case is still unlinked, and then we are worried that she might pose some risks to the community. So we have issued many compulsory testing notice. So now if you've been to these places, even if you are not certain whether you were there at the same time as the case, you should be tested. Sewage samples, I know there will be a corresponding compulsory testing notice to be issued. That flight attendant on the 30th and the 31st of December, she has spread the disease to many others on various occasions, mainly at eating places, and these are known source of infection. Usually, in the past, we had super spreaders spreading the disease to many at one location. But then for Omicron, because it's highly infectious, we do not have a full understanding of this virus in the community. So we don't know whether for this case is the involvement of super spreader, or is it just normal for the Omicron virus.
Morning Post. First, for the domestic helper who is believed to infect preliminary positive her employer and the 13-year-old ward, is this considered the 5th generation of transmission? And is there a need to suspend schools and to instate work from home? And for the preliminary case who attended the Jungin concert, can you clarify how many people attended that concert on which day, and do they need to be sent to quarantine? And we would like to also clarify a few details about the quarantine situation at Penny's Bay right now. So Dr. Ao this afternoon said that guests who arrive at the birthday party on January 3 do not need to, they will revoke the quarantine order for them. So how many people's quarantine order is revoked that don't need to be sent to Penny's Bay at the moment?
I have to calculate how many generations. I think it's at least 3 or 4 generations already. So I'm not sure. I do not have a figure at hand for the concert of Jungin, but usually the concert will consist quite some people. So we'll put all those who attended the concert under compulsory testing notice. So everyone have to go to test at the scheduled advice. So our quarantine center, the capacity, of course, is limited. So we need to closely monitor the situation and see whether we have any backup plan or any surge capacity. As for school suspension, I think this will depend on quite a number of factors, including public health consideration. I'm sure the government will consider all in a whole.
So among the 180 guests at the birthday party on January 3, how many do not need to be sent to Penny's Bay?
180. I do not have the exact figure at hand because we have a list of the participants, and for those who came after 9:30, we have sent them to the quarantine center already. But for those who are sure they have left before 9:30, of course, we will not send them to the quarantine. So maybe, but we need to check one by one, so I do not have the exact figure.
下一題，後面嗰位。
The reporter in blue. Ming Pao. First question about the preliminary positive case. You said that on the 3rd of January, this person went to Leighton Center for a test, and then the person went to the same place on the 4th of January. What happened on the 3rd of January? Was it because the center was overcrowded so that the person couldn't get tested? What happened? Does it mean that the testing centers are at capacity at the moment? Another question about someone who went to the Six Garden restaurant, a 3-year-old child. Are you concerned that if he stays in the community for another day, that adds to the risk of spreading the virus? Another question. For the birthday party on the 3rd of January, how many people attended the party after 9:30 p.m. that day, but have yet to be sent to the Penny's Bay Quarantine Center? When can we expect all those people to be sent to the quarantine center? A question about the Six Garden restaurant. You said you didn't reach everyone who were there, so how are things coming along on that front? For this 3-year-old child, he got tested on the 4th of January. Before being sent to a quarantine center, he tested negative. So the risk he posed to the community was rather low. On the 3rd of January, the child was at the community center for a test. I need to further check the information before I can tell what happened as to why he couldn't get tested at that time. I'm sorry, what was your second question? How many people attended the birthday party after 9:30 on the 3rd of January. We do have a list of attendees. For those who attended the party after 9:30 p.m., most of them have been sent to quarantine centers. But there may be certain individuals who are not on the list, and some may be attending the party as they went along with someone else, so we have to investigate further. As for the 6 garden restaurants, we don't have any further update at the moment. Next question, the report at the front, at the left. TVB. The question about the aircraft cabin cleaner. Has the cleaner violated any protocol while performing the cleaning duties, leading to the infection? Did this worker have enough protective equipment while doing his or her work? A question about the Hinschern concert. Do you have the number of the people who were at the concert? People had their masks on during the concert, but at moments, certain times, people may be cheering, yelling. They may come into contact into an infected person. Are you worried about the risk of outbreak there? As for the Hinschern concert, we're reaching out to the relevant parties. But it's not hard to find out how many people were there at the concert. We are worried. Sometimes people went to the washroom, or some people didn't put on a mask properly. There might be a risk of transmission. But it's hard to tell exactly who were exposed. So everyone who attended the concert will have to get tested. It's hard to tell exactly what happened at the moment. As for the person who were cleaning aircraft cabins, we're clarifying the planes where the worker performed cleaning duties. We know this cleaner had to clean the cabins of several planes, most of them Cathay Pacific flights. This cleaner would also clean the cabins of other planes on a contract basis, but we have to clarify with the person further. Next question, the journalist, the lady at the back. HK01. Questions about the preliminary positive cases. A question about the 3-year-old child. You said his other classmates also developed symptoms. Could you tell us the risk of spreading at the school? How many people would have to be quarantined at his kindergarten? A question about the cabin cleaner. What's the status about the cleaner's co-workers? Is the worker vaccinated? Which company is this worker from? We see many cases have had activities in Causeway Bay or Wan Chai. What's your assessment of the risk of outbreak in Wan Chai and Causeway Bay? You said that many people were lining up for a test at the Leighton Hill Community Center. Do we have enough testing capacity at Leighton Hill? The third question, Professor Sophia Chen said today that if quarantine centers are at capacity, people will have to do home quarantine. Dr. Chuang, what's your take on home quarantine? We had cases of vertical transmission in the past. If people are doing home quarantine, would that pose risks to the community? The classmates of the 3-year-old child. Now we have this system in place monitoring upper respiratory tract infection cases when 3 or more students develop symptoms of upper respiratory tract infection. We get notified by the schools or kindergartens. We can tell apart whether it's just upper respiratory tract infection or COVID. So we normally ask the school to suspend classes, and then all students and teachers will have to get tested. For secondary schools, we ask them to do tests by class or by grade. But for kindergartens, the entire kindergarten will have to get tested. Apart from this child, We also see 3 other children. I just had to clarify the total number. We received reports about these children. And these are close contact. So the child was sent to a quarantine center, so there are other people who are close contact. One of them is in the same class as this infected person. Normally people in the same class have more frequent contact, so we treat such people as close contact. But for other people, other classmates at the same school in other classes with symptoms of respiratory tract infection, they will need to get tested first. That's how we can tell if COVID is spreading at the school. As for the risks of outbreak in Wanchai and Causeway Bay. Sorry, what's your question again? The risk of outbreak. In previous outbreaks, or rather looking at the current situation, people go to restaurants, stores near where to live, so there is certainly some risks to the people nearby. That's why for buildings with COVID cases, we require the people living there to get tested, because we are worried that people nearby may be at risk. Home quarantine is an option of last resort. If quarantine facilities are at capacity, I believe the government will try to find other places and turn them into quarantine centers. But if there is absolutely no other places available, then the last option is to do home quarantine. At the kindergarten, how many people need to be quarantined? I don't have the total number yet. There are roughly 500 or so students at the kindergarten, but not everyone will have to be quarantined. There may be 20, 30 people each class. But we have to find out whether they have classes involving several groups of students at once. Next question, the lady at the back. Sorry, which media organization? I'm from Commercial Radio. I have a question about this case who went to a Hinstrand concert. Is it a preliminary positive case, or is this someone who got confirmed today and related to an imported cases? On which day did this person go to the Hinstrand concert? Did this person got tested positive after being sent to quarantine center?
Yeah. I'm also a bit mixed up as to who have been to Hinstrand's concert. All right. The case was sent to a quarantine center and preliminary positive. The CT value was rather low. It was a positive case with a CT value of about 22, tested by HA, and he was sent from quarantine center to hospital, and I think tonight he'll become a confirmed case. The 3rd of January evening, starting from around 7-ish to 8. Any more questions? Speakers off mic. Ling Yang Tong, she's in Sang Yao A class. If there are no further questions, then the briefing ends here.